Your feet tingle at night. Your hands go numb for no clear reason. You feel burning, stabbing, or electroshock pain that no doctor can fully explain. Now, let me ask you something serious. What if there is a poison you re-exposed to every single day, something so common you barely notice it that is quietly damaging your nerves right now? This isn't about masking pain. This isn't about learning to live with it. This is about stopping nerve damage before it becomes permanent. Stay with me for the next few minutes, because what you're about to learn could protect your nerves while there's still time. My name is Dr. Emily Carter, and for decades, I've worked with seniors struggling with nerve pain, numbness, burning feet, balance problems, and a condition many people are told is unavoidable, neuropathy. One of the most heartbreaking things I see is how often people are given the wrong explanation for why their nerves are failing. They're told it's just aging. They're told it's genetic. They're told nothing can be done. And in many cases, none of that is true. Before we go any further, take a second and comment your age and where you're watching from today. Have you experienced tingling, numbness, or burning in your hands or feet? Did you know blood sugar can damage nerves even if you don't have diabetes? Write your answer below, because awareness is your first line of defense. Once nerve damage passes a certain point, we don't get unlimited chances to reverse course. And if you want more practical, life-saving strategies like this to help you stay strong after 60, make sure you're subscribed. Let me tell you about a patient named Frank. Frank was 68, recently retired, and still active, but at night, his feet burned. During the day, his toes felt numb. Sometimes sharp, electric pains shot through his legs without warning. He was told it was probably age, maybe circulation, maybe one of those things. But when we looked deeper, we found something else, a daily exposure. Something he believed was harmless. In reality, it was slowly poisoning his nerves. When we removed it, the damage didn't reverse overnight, but it stopped getting worse. And that changed everything. So what was the poison? And how many seniors are unknowingly feeding it to themselves every single day? To understand that, you need to know one important truth about nerves. Nerves are living tissue. They are not wires. They depend on oxygen, nutrients, and a stable internal environment to survive. And unlike skin or muscle, nerves heal extremely slowly. That means damage builds quietly over time. Long before you feel pain, tingling, or numbness, your nerves may already be under attack. Here's where things get uncomfortable. The most damaging poison destroying seniors' nerves isn't some rare chemical. It's not industrial toxins. It's not even alcohol by itself. The most destructive poison is something many seniors are encouraged to consume every day: chronic blood sugar toxicity. And this part is critical. You do not need diabetes for blood sugar to damage your nerves. You only need repeated spikes. Millions of seniors experience these spikes daily without realizing it. When blood sugar rises too high, sugar molecules bind to nerve fibers and the tiny blood vessels that feed them. This triggers inflammation, oxidative stress, and damage to the protective coating around nerves. Over time, nerves lose their ability to transmit clean signals. First comes tingling, then numbness, then burning, then pain, then balance problems. Neuropathy doesn't appear suddenly. It develops silently often, for years while the poison works in the background. Let me ask you something important. Have you ever been told you're borderline diabetic, pre-diabetic, or that your blood sugar is a little high but not dangerous? That's often where nerve damage begins. Research now shows prediabetes can damage nerves almost as frequently as full diabetes. The difference is most people don't know it's happening, and this is where many people say, "But I eat healthy." Most of my patients believe that too. That's the problem. This poison hides inside foods and habits that sound healthy. Here's how it works. You eat something that spikes blood sugar. Your body releases insulin to manage it. Over time, cells become resistant. Sugar stays in the bloodstream longer. Your longest nerve stalls in your feet and hands are exposed again and again. The tiny blood vessels feeding those nerves become damaged. Oxygen delivery drops. Nerves slowly starve because it happens gradually. People say it came out of nowhere, when in reality, it's been building for years. Now you might wonder, if blood sugar is so damaging, why doesn't everyone get neuropathy? Because it depends on frequency, duration, and nerve resilience. Some nerves tolerate abuse longer than others, but once damage crosses a threshold, symptoms often accelerate fast. So where does this poison come from? First, liquid sugar. Fruit juice, sweetened coffee drinks, sports drinks, even healthy smoothies. Liquid sugar enters your bloodstream almost instantly. There's no fiber to slow it down. That spike directly harms nerve tissue. Seniors are often told juice is gentle nutrition. In reality, it's one of the fastest ways to damage nerves. Second, refined carbohydrates, eaten alone. Bread, cereal, crackers, rice, pasta, especially without protein or fat. These turn into sugar rapidly, easy to digest, often means fast blood sugar spike. Third, constant snacking. When insulin stays elevated all day, nerves never get a recovery window. This is why grazing is especially damaging to nerve health. Here's something most people are never told. Certain medications quietly worsen nerve damage by interfering with nutrient absorption, especially B vitamins. Acid blockers, some diabetes medications, and cholesterol drugs can deplete B12 over time. B12 is essential for protecting the nerve's outer coating. Without it, nerves misfire and weaken. I had a patient named Susan with numb feet for years. Doctors blamed age. Testing revealed severe B12 deficiency, not from diet, but from long-term medication use. Once corrected, her nerve damage stopped progressing. Not reversed, but stabilized. And that matters. Neuropathy is rarely caused by just one thing. It's usually a combination of blood sugar, toxicity, inflammation, nutrient depletion, and circulation issues. But blood sugar is it's the gasoline on the fire. That's why timing matters. Early nerve damage may feel like tingling or mild numbness. Later damage leads to pain, balance, loss, falls, and loss of independence. Once an absorption, regeneration is extremely limited. That's why stopping the poison early is so critical. Here's what I want you to hear clearly. Neuropathy isn't always reversible, but in many cases, it can be stopped from getting worse. And preserving function can change everything. So what protects nerves? The answer isn't extreme diets or miracle supplements. It starts with blood sugar stability, not perfection. Consistency. Every sharp blood sugar spike is like a small chemical burn to nerve tissue. Fewer spikes mean less damage. Here's the most important rule I teach seniors with neuropathy. Never eat carbohydrates alone. Not fruits, not bread, not cereal. Carbs by themselves hit the bloodstream too fast. But when eaten with protein or healthy fat, absorption slows dramatically. Same food, completely different impact. This explains why some seniors develop severe neuropathy while others don't avone with similar diets. It's not just what you eat, it's how you eat it. One patient, James, 74, drank a fruit smoothie every morning, thinking it was healthy. That liquid sugar hit his bloodstream unprotected. We replaced it with eggs and vegetables and moved fruit to later in the day after meals. Within weeks, his burning eased and his balance improved. Nothing magical. We simply stopped poisoning his nerves. Next, remove liquid sugar completely. No juice. No sweetened drinks. No smoothies. If you eat fruit, eat it whole, in small amounts, and never on an empty stomach. Then nutrient protection. B, 12, magnesium, folate, alpha-lipoic acid. These don't cure nerve damage, but they help protect what remains. Important warning: more's not better. High doses of certain vitamins, especially B6, can worsen nerve damage. Always consult your doctor. Reduce inflammation. Move gently, especially after meals. 10 minutes of walking can lower blood sugar and improve circulation. And finally, understand this: stopping progression is powerful. Less pain, better sleep, improved balance, fewer falls. That's independence. If you're experiencing tingling or numbness, those are warnings, not verdicts. Before you go, comment your age and where you're watching from. Have you been told this is just aging? Have you tried stabilizing blood sugar? I read every comment. Share this with someone who needs it. Too many people suffer because they're told nothing can be done. You have more control than you think. Protecting your nerves starts with removing the poison starting today. At this point, it's important to approach this topic with clarity and realism. Neuropathy is a medical condition with measurable biological causes. It is not imagined. It is not weakness. And it is not an unavoidable consequence of aging. In clinical practice, nerve damage follows patterns, and those patterns tell a story long before symptoms become severe. When blood sugar remains unstable over time, even at levels considered borderline, it creates a biochemical environment that nerves cannot tolerate indefinitely. This process is slow, cumulative, and often overlooked because standard blood tests may still appear acceptable. However, nerve tissue is far more sensitive than many other systems in the body. From a clinical standpoint, the goal is not to chase symptoms after they become severe. The goal is to reduce ongoing nerve stress, preserve remaining nerve function, and lower the risk of progression. This approach aligns with what we see consistently in long-term patient outcomes. Stabilizing blood sugar reduces oxidative stress. Correcting nutrient deficiencies supports myelin integrity. Reducing inflammation quiets abnormal nerve signaling. Gentle movement improves microcirculation to peripheral nerves. Each of these interventions may seem modest on its own, but together they create a protective environment where nerves are no longer under constant attack. That is how progression slows. That is how function is preserved. It's also important to set appropriate expectations. Nerve tissue regenerates slowly, and in some cases, damage cannot be fully reversed. However, clinical improvement does not always require full regeneration. Even partial restoration of signal quality and reduced inflammation can lead to meaningful improvements in comfort, balance, sleep, quality, and daily confidence. From a professional perspective, the most dangerous message a patient can receive is that nothing can be done. That belief often leads to inaction, and inaction allows damage to continue unchecked. In contrast, informed, early intervention can significantly alter the trajectory of neuropathy. If you are experiencing tingling, numbness, burning, or balance changes, consider these symptoms as early warning signals rather than final outcomes. They indicate that your nervous system is under stress and stressors can be reduced. Protecting nerve health is not about extreme measures. It is about consistency, awareness, and timely correction. The earlier the underlying causes are addressed, the greater the chance of preserving independence, mobility, and quality of life. From a medical perspective, peripheral neuropathy represents a failure of communication between the nervous system and the body. These signals control sensation, movement, balance, and even automatic functions such as blood flow and temperature regulation. When nerves are damaged, the body does not simply lose feeling it, loses accuracy, timing, and protective feedback. This is why neuropathy increases the risk of falls, injuries, infections, and loss of independence. A person may not feel pressure points in their feet, may misjudge their footing, or may fail to notice small injuries that later become serious complications. Clinically, these secondary consequences are often more dangerous than the pain itself. One reason neuropathy is frequently mismanaged is because early nerve damage does not always appear on routine imaging or standard lab tests. Nerves can be metabolically stressed long before structural damage becomes obvious. By the time symptoms are severe enough to demand attention, the condition may already be well established. That is why early intervention is critical. When blood sugar spikes repeatedly, it alters the internal chemistry of nerve cells. Excess glucose leads to the formation of advanced glycation end products, which disrupt normal nerve metabolism and impair blood flow at the microscopic level. Over time, this reduces oxygen delivery and interferes with the nerve's ability to repair itself. At the same time, chronic inflammation amplifies pain signals and lowers the threshold at which nerves fire abnormally. This explains why some individuals experience intense burning or stabbing sensations, even when nerve loss appears mild on examination. The nerves are not only damaged, they are hypersensitized. Nutrient deficiencies further compound the problem. Vitamins such as B12 and folate are required for DNA synthesis and myelin maintenance. Without adequate levels, nerve fibers lose insulation, resulting in signal leakage, delayed conduction, and this manifests clinically as numbness, tingling, weakness, and poor coordination. Importantly, these mechanisms often occur simultaneously. Neuropathy is rarely the result of a single factor. It is usually the cumulative effect of metabolic stress, inflammation, nutrient depletion, and impaired circulation acting together over time. This is why isolated treatments often fail. Pain medications may dull sensation temporarily, but they do not address the underlying nerve injury. Likewise, supplements taken without correcting blood sugar instability may provide limited benefit. Effective management requires a comprehensive strategy focused on removing ongoing insults to the nervous system. From a professional standpoint, the objective is threefold. First, reduce further nerve injury. Second, stabilize existing nerve function. Third, preserve mobility and safety. Even modest improvements in nerve signaling can translate into meaningful functional gains. Improved balance, fewer nighttime symptoms, better sleep quality, and increased walking confidence all contribute to long-term health outcomes. It is also important to recognize that neuropathy progression is not linear. Many patients experience periods of rapid worsening followed by stabilization once contributing factors are addressed. This means intervention at any stage may still provide benefit, particularly in slowing or halting further decline. Patients who take action early when symptoms are intermittent or mild generally maintain better function over time than those who wait until pain or disability becomes severe. This pattern is consistently observed in clinical practice. Therefore, tingling, numbness, or burning should never be dismissed as just aging. These symptoms are physiological signals indicating that nerve tissue is under stress. When those signals are acknowledged early, outcomes improve. In closing, nerve health is not determined by age alone. It is influenced daily by metabolic stability, nutritional status, inflammatory burden, and circulation. While not all nerve damage can be reversed, much of it can be slowed, stabilized, or prevented from progressing. Protecting your nerves is ultimately about preserving independence, mobility, and quality of life. The earlier corrective steps are taken, the greater the likelihood of maintaining function and avoiding complications that compromise long-term health.